For me, probably the biggest one is to have a really good understanding of your numbers. And I don't mean things like just your diary occupancy, just your retention numbers, rebooking rates, early self-discharge, numbers of new patients. I mean, they're all important and they are all things that could and should be monitored for a healthy, successful practice. But I think what's also important is that you know your financials that underpin that. And I see a lot of clinics that know their revenue. So they know how they're going from a revenue point of view year on year, but they don't necessarily understand the benchmarks by which they should be measuring their wage costs, both clinical and admin, their occupancy, their rent, and probably the biggest metric is they don't necessarily understand their profit margin and how much profit they are making month on month, quarter on quarter, year on year. So I encourage all of them to, at least through their accountant usually, is to set up what I call a really clean profit and loss statement. So that's one where they are taking out an appropriate wage for the time that they're spending, a market rate for their time. They are not including things like add backs, which are one-off or discretionary expenses that happen, and run that P&L to get a good understanding of how well that business is actually performing from a financial health perspective. So that would probably be my number one metric, because we get very drilled into what's happening at that micro level of patient numbers and retention, but how that looks at a macro level in terms of your actual financial performance, I think is often overlooked or not well understood.